Welcome to For Pay, which stands for Foremost Organization Reimbursement Plan and Adjustment Yields. Reimbursement Plan and Adjusted Yields. That is foremost forpay.org. This is Consumers Dr. Vendala. This is the cool gadgets segment. Let's talk about some of the cool apps associated with gadgets. So today's topic is apps. What are the best healthcare apps? So what do you consider as an app? Health app is categorized by the FDA as a mobile software that diagnoses and tracks and treat diseases, folks. Yes, it treats diseases. It is a wellness app, enhances and tracks overall health of the user. This cool gadget segment will first talk about apps, and it'll be broadcasting live some cool gadgets available for consumers. Forpay.org. Again, it stands for Foremost Organization Reimbursement Plan. Adjusted yields means adjusted income. Through healthcare, yes, through healthcare. Saving the money on the premiums, putting money aside into the health savings. So let's go into the details about what are the best healthcare apps we have. Simply having a mobile app is not enough. You need to have the engagement with consumers. So what are those healthcare apps for consumers? I have identified 8 best healthcare apps. Number 1 is called Generous. Regarding DNA and nutrition. It is Generous is on a mission to help people improve their lives by understanding their genes. This innovative healthcare apps, it is powered by an individual DNA. Interface is easy to use, aesthetically beautiful, which may be the reason why consumers love it. DNA-based active fitness recommendation, food, nutrition, supplemental recommendation, and more. It helps consumers to understand their genes while providing safe and accurate and actionable steps. Goal is to empower consumers through education and the best intervention by the consumers. Generous can retrieve the DNA data from 23andMe and Ancestry.com. 23andMe and Ancestry.com. App users can receive recommendation based on the goals and the lifestyle inputs. Generis gives different recommendations, and also it has proven to impact the wellness trait to the consumers. Every claim that Generis makes is backed up by scientific evidence in peer-reviewed journals, folks. That's number one app. Number two, Teledoc, which has a 24/7 access to a doctor. That's really empowers the consumer. Teledoc app, either on the iPhone or Android, connects patients to a board-certified doctor 24/7 through the convenience of phone or video visits. It provides consumers quick and easy communication with doctors which are ready to listen and resolve their issues. If necessary, doctors can quickly prescribe medications and connect with pharmacy of choice. Yes. Teledoc integrates Apple HealthKit to enhance the user experience. This seamless integration now enables consumers to form better diagnosis and import patients it enables doctors to form a better diagnosis and import patients' most recent medical details. What is the number third app, you may ask? Online counseling. Online counseling. It's called BetterHelp. Online counseling. This app is a trailblazer on counseling. Yes, counseling. Allows consumers to have quick customers or consumers or patients, no matter whatever you may call, quick, inexpensive, easy access to mental health professionals. BetterHelp does that. BetterHelp app. BetterHelp is a convenient way to get professional help through licensed therapists and counselors online. Yes, counselors online. Patients enjoy individualized private care through video chat and messaging. And patients' reviews. There's lots of reviews for this app, folks, which will give you the satisfied customers, satisfied patients after the therapy session with the BetterHelp. Online counseling provides a safe space for everyone. There are several, almost like 3,000 trained, experienced, accredited counselors with BetterHelp. They take care of people with depression, anxiety, to family and couples. This healthcare app individualizes the experience, connects with patients, with counselors. They also have group webinar offerings, fostering community and support for the patients. Yes, for the patients. The next app is called MDACNE. MDACNE. The way you say it, MDACNE, for acne treatment. MD acne, so-called MD acne is called MD acne for the acne treatment, folks, for the acne treatment. MD acne gives immediate access to the dermatologist. Yes. MD acne is the future for acne treatment. In less than 5 minutes, they're able to provide a treatment based on user skin. This app is incredibly easy to use and a wonderful interface, folks. Wonderful interface, yes. MD Acne has advanced tech that monitors the skin and sets treatment reminders, initiates the chats with the dermatologist, and provides recommendations. If patients are put off by the chemical treatments, they also share natural remedies to help most frustrating acne issues like scarring and redness. Basically, the way it works is patients answer some questions regarding their skin. They take a picture of their acne, and this app assesses the skin and recommends treatment that can be crafted for the user and sent it to their doorstep for the acne. It just lands on your lap, folks. Basically, you get treatment and medication. What is the next app? Leafly. Leafly, again, this medical marijuana has been hyped up so much for pain relief. It may be overly used, but you need to be careful, folks. This Leafly app is a one-stop shop for cannabis information. I'm not sure I would go for this, but people who use cannabis for the pain, this is an app. It connects with the doctors. Leafly connects with the patients, with doctors, clinics, and dispensaries, just a click away. So Leafly sheds some light on previously controversial, so-called controversial plant, cannabis. Leafly provides safe and actionable steps backed by lab source data. So this is for people who use cannabis, folks. The next best app is My Sugar. My SUGR, sugar. This is a diabetes treatment log, folks. Diabetes treatment log. My Sugar allows patients to track their blood sugar, carbs, bolus, and estimated hemoglobin A1C all at a glance. All at a glance, yes. This app does that. My Sugar has transformed some of their, participating customers. Logging their data into this app to have basically a better control over their diabetes. And doctors also allowed to review the data for them to treat better. This My Sugar app presents motivating challenges, feedback to help cope with type 2 and type 1 and type 2 diabetes. Diabetes itself is a difficult to cope up with. This app has been important to ally to many, important ally many. The next app, 7th, is called I Care Life. I Care Life allows you to connect with your own eye doctor through convenience of your smartphone. Yes. This healthcare apps works for patients experiencing dry eyes, allergy eyes, and questions about contact lenses. Questions about contact lenses. It is not this app is not recommended to use this app if you're experiencing serious eye conditions. What this does is, first you're connected to a doctor. You are asked to record your condition through pictures or videos of affected eyes. Within minutes, your eye doctor is able to see you through high definition video to better understand, help resolve your condition. Number 8 app is called Heal. Heal. Heal is a physician house calls are back, folks. Physician house calls are back, yes. Physicians used to make house calls date back in 1930s. Its popularity fell in 20th century. But now, physicians' house calls are back because of the COVID pandemic. This app, Heal, provides a peace of mind, allowing patients to provide exposure to contagious viruses at the doctor's office or urgent care. This app, Heal, patients are realizing that home visits enable doctors to get a holistic view what could be influencing their health by observing their environment and overall lifestyle. This holistic view allows doctors to better care and recommendations for their patients. Heal is currently available to 102 million Americans in almost all the states. For patients without insurance, if you have HSA, you can pay through your debit card, through your HSA. You pay as you get the care. You see what these healthcare apps are working so diligently to transform their services and provide patients with care and convenience to the patients. These innovative mobile healthcare apps development will continue to grow and improve. It is important for users like customers, clients, patients to understand these apps still do not completely replace in-person annual checkups, and patients still physically report to professionals when necessary. This doesn't replace in-person visits to the doctors. However, during these times of coronavirus and epidemics internationally, these technologies seems to favor. These apps seems to help calm the patients, with the online help they can use through their mobile technology, folks. These apps, these healthcare apps, transform the lives of many for better and will continue to grow. This is consumer, these apps help the consumer driven healthcare. People who have so called deductible plans with HSA, they can pay as you get the care. I'll continue to give you some interesting, cool gadgets for patients in the next segment. Thank you for listening. This is forpay.org, which stands for Foremost Organization Reimbursement Plan. Adjusted yields like adjusted income. This is Consumers Dr. Bengal. If you like this channel, subscribe, share, and we will see you in the next episode. Goodbye. I love you.